Kidney inflammation, which doctors call nephritis, makes it hard for your kidneys to clean your blood. They can't remove waste and extra fluid like they should. If you don't take care of nephritis, it can cause long-term kidney problems, kidney failure, or even really dangerous health issues. Some kidney problems happen slowly, but others have serious signs that mean you need to see a doctor right away. In this video, we'll talk about the serious signs of kidney inflammation that you shouldn't ignore. We'll also talk about what causes them and when you need to get help fast. One of the first and most worrying signs of kidney inflammation is serious pain in your lower back or flanks, which are the sides of your body near your ribs and spine. This pain might be there all the time or come and go. It can be sharp or dull, and it can spread to your belly or groin. Why this happens? Infections like pyelonephritis, a bad kidney infection, cause swelling and irritation in the kidneys, leading to pain. Kidney stones can block your urinary tract, causing inflammation and extreme pain. Autoimmune conditions like lupus nephritis make your immune system attack your kidney tissue, causing discomfort. When to get help? If the pain is very bad and doesn't go away, if you have a fever, feel sick to your stomach, or are throwing up, if the pain gets worse when you move or take a deep breath. Seeing blood in your pee can be really scary, and you shouldn't ignore it. Pee with blood in it can look pink, red, or brown. Or sometimes you can only see it with a microscope. Why this happens? Glomerulonephritis, which is a kind of kidney problem, messes up the tiny filters in your kidneys called glomeruli. This lets red blood cells get into your pee. Kidney infections can make your pee tubes sore and bleed a little. Kidney stones or lumps in your kidney can break little blood vessels and make you pee blood. When to get help if you see blood in your pee? If it hurts when you pee, you have a fever, or it's hard to pee. If your pee stays a weird color for more than a day. While a few bubbles in your pee are okay, lots of bubbles or foamy pee can mean a serious problem with your kidneys. Why this happens? Proteinuria, or too much protein in your pee, happens when your kidneys get swollen and hurt. This hurts tiny parts of your kidneys called glomeruli. When the glomeruli are hurt, protein, like albumin, leaks into your pee. This is a big sign of nephrotic syndrome, a serious kidney problem. When to get help? If your pee looks frothy every time you go potty. If you have puffy legs, a puffy face, or a puffy belly. If you already know you have diabetes, high blood pressure, or kidney problems. Fluid retention, also known as edema, is a common sign of kidney problems. The kidneys are important for keeping the right amount of fluid in our bodies. When they're inflamed, they can't get rid of extra fluid like they should. Here's why this happens. Losing protein in your pee makes it harder for your body to hold on to fluid, so it builds up. Kidney inflammation can also make your body hold on to too much salt, which also causes swelling. When should you see a doctor? If the swelling comes on quickly and gets worse fast, if you're also gaining weight or having trouble breathing, or if your rings, shoes, or clothes suddenly feel too tight. Kidneys help control your blood pressure by managing how much fluid is in your body. They also make hormones. When kidneys get inflamed, your blood pressure can get dangerously high. Why does this happen? When kidneys are damaged by inflammation, they can't filter out sodium and fluid like they should. This leads to too much fluid in your body, and that puts extra pressure on your blood vessels. Kidney disease can also mess up the balance of renin, a hormone that controls blood pressure. When should you see a doctor? If your blood pressure is always high, like 140/90 or higher. If you get headaches, feel dizzy, or have blurry vision along with high blood pressure. If you already have a kidney disease, or if kidney problems run in your family. Feeling really tired, weak, or worn out, even after resting, could be a sign of kidney inflammation. Here's why it happens. Damaged kidneys can't filter out bad stuff, so waste builds up in your blood. This is called uremia, and it makes you tired, sick to your stomach, and confused. Kidney inflammation can also cause anemia, which means you don't have enough red blood cells. Red blood cells carry oxygen, so without enough of them, your body doesn't get enough oxygen. When should you get help? If your tiredness is really bad, doesn't go away, or is getting worse. Also, if you're short of breath, have pale skin, or feel dizzy, and if everyday things are getting hard to do because you're so weak. Tummy troubles like feeling sick, throwing up, and not wanting to eat are common when kidney disease gets worse. Here's why it happens. Bad stuff builds up in your blood called uremia, and it can make your tummy feel upset. Kidney inflammation messes up the balance of things in your body, leading to a yucky metal taste in your mouth, bad breath, and trouble digesting food. When should you get help? If you're feeling sick and throwing up a lot, if you're losing lots of weight because you don't want to eat, if you're feeling confused or super tired along with these other problems. Kidney inflammation can make fluid build up in your lungs and heart. This can cause serious breathing and heart problems. This happens because extra fluid in your body can gather in your lungs. This is called pulmonary edema, and it makes it hard to breathe. A build-up of waste products in your blood called uremia can cause pericarditis. Pericarditis is when the lining around your heart gets inflamed and causes chest pain. Go to the doctor right away if you suddenly have trouble breathing, or if it's very hard to breathe. See a doctor if your chest pain is sharp or stabbing, or if it gets worse when you lie down. Also, see a doctor if you have trouble breathing, even when you are resting. Gap 3S. Changes in how often you pee can also be a big sign of kidney problems. You might see more pee or less pee than usual, or you might have to pee more often, especially at night. Sometimes your pee might look different, like darker or more concentrated. Here's why it happens. Kidney inflammation can make it hard for your kidneys to clean your blood and get rid of extra fluid, and that changes how you pee. This could be because of bad stuff building up in your body, or because the important salts in your blood aren't balanced right. When should you see a doctor? If you see a big change in how you pee, like suddenly peeing a lot more or a lot less, or if your pee looks really dark or cloudy, it's important to talk to a doctor. These changes could mean your kidneys are inflamed or that something else is wrong. Remember, listening to your body and talking to a doctor quickly can really help keep your kidneys healthy. In conclusion, don't ignore the warning signs. Kidney inflammation can cause very serious, life-threatening problems if not treated. If you see any of the symptoms we talked about, go to the doctor right away. Getting diagnosed and treated early can stop kidney failure and make you healthier. If you have diabetes, high blood pressure, a family history of kidney disease, or problems with your immune system, you have a greater chance of having kidney problems and should check your kidney health often. Your kidneys are super important. Pay attention to them and don't ignore any warning signs.